Hello and welcome back to Doodles MD. I'm Falake Lawal, your public health, internal medicine and infectious diseases physician. This week we're going to be talking about heart rhythm disorders or diseases. Before we start on that, have you subscribed to our channel? Please click the subscribe button so that you can get our notifications once we post new videos. Stay tuned. Heart rhythm disorders are known as dysrhythmias. Dys is abnormal and rhythmia is for the rhythm. Commonly, you could also hear arrhythmia. That's the most common word that's used to describe it. And this just means either there's an abnormality in the speed or the pattern of the heartbeats. Okay? To classify heart rhythm disorders, the first place to start is the rate, the speed, right? When the normal heart rate, first of all, is between 60 and 100. Now, if it's less than 60, we call that bradyarrhythmia or bradycardia. And when it is greater than 100, we call that tachyarrhythmia or commonly tachycardia. So that's the first place that we start to distinguish them. Now, when we go from the speed, after the speed, we now go to the origin. What part of the heart is this abnormal rhythm coming from? And remember, we talked about the upper chambers and the lower chambers. The upper chambers, the atrium, the lower chambers, the ventricle. So we have something called supraventricular, which is above the ventricle. The ventricles are down above the ventricle. So we have tachycardias that come from above, originate above the ventricles, and then we have ventricular tachycardias. How do people know that they have disorders of the cardiac or the heart rhythm, dysrhythmias? A lot of these heart rhythm disorders are actually asymptomatic. When they're actually symptomatic, people actually don't feel good. One of the first and easy signs or symptoms that people complain of is what we call palpitations, where your heartbeat, you can feel like you can hear your heart beating. It feels like it's really beating hard or differently, and people have that. Also, sudden tachycardia. Like we said, some of the supraventricular tachycardias, they can go up to 200, right? So imagine someone that has a heart rate of 70 something and their heart rate goes up to like 200 and something. That's like times 3, and that could happen. Or it goes up to 160. You can feel your heart racing, right? So it just comes out of the blue. You're not exercising or doing anything. Boom, your heart starts racing. Next symptom is shortness of breath. We all call dyspnea, but shortness of breath is kind of like a chest tightness. Think about when you run up a hill, go to the gym and you're doing extraneous exercise, or you're running trying to catch the bus, right? And you're out of breath. You're like, oh my God, I can't breathe. It's called air hunger, difficulty breathing. You're breathless. You feel like you're suffocating. There's an intense tightening in your chest. That people feel that when they do extraneous exercise and things like that. So imagine someone sitting down by themselves and boom, you start feeling like, oh my God, I can't breathe. It drives you crazy, right? So that's what shortness of breath is. So when your heart is beating too fast, okay, it cannot get out enough blood out of the heart. The blood goes out of the heart, and then that means that the blood coming from the lungs cannot leave the lungs to fill the heart. So you have a backlog of fluid into the lungs. And also just the speed of the work that's being done and the oxygen that's consumed also makes you short of breath. Another is irregular pulse. Some can feel it, and sometimes, you can just check your pulse either at the neck of your wrist or at the base of your neck here. Another symptom is another sign is hypotension. It is a sign, but it presents, the symptoms of hypotension come as dizziness, right? You feel like the room is spinning, or you feel like you are spinning. The other is lightheadedness. If you're lying down and you raise your head and you feel a little woozy, you feel like, whew, I just feel lightheaded. Or you get up too fast, you feel lightheaded. People have that, right? But people who are having arrhythmias or dysrhythmias, out of the blue, no changing anything, they start feeling that. On the extreme of that is fainting, okay? The last symptom, honestly, sudden death. Yep, people can just pass out just like that, and within a few minutes, they're gone. So this is something that we really should take serious. When somebody now has an arrhythmia or a dysrhythmias, what happens next? You know, you get evaluated. You go to your doctor. Hey, I've been having this feeling in my chest, or while you're having it, you go to the emergency room, you go to the hospital. The first thing they do is to do what we call an electrocardiogram. It's called ECG or EKG, depending on what part of the world you're in. And this again checks the electrical activity of your heart, and it's seen on a tracing as shown below. Okay. And different heart rhythms will show. The normal has a way that it looks, and they would show, and you'll be able to either detect the rate or the type of waves that you have. Now, EKG is lucky because it's a one-time test. If person is having it right now, you can catch it. But if you had it like yesterday and like I need to go to my doctor and they tell you come back next week and you don't have it next week, what can they do, right? Now, the next step is Holter or ambulatory ECG, where you wear a little outside contraption and for like 24 hours, if it happens frequently enough, 24 hours, so that it can catch that rhythm when it happens and you're not at your doctor's office or you're not in the hospital. Another one is a loop recorder, and a loop recorder is placed for people who have less frequent symptoms. It doesn't happen that often, and you want to try and catch it. In some cases, it can sit on the skin, and in some places, it can be inserted underneath the skin. You wear it for a few days, and then sometimes when it senses there's a change that's beginning, it starts recording, and after the number of days, they take it out and analyze the rhythm. Okay, so that's what is done. Of course, some other things are checked, like echo, which is ultrasound of the heart. They check your electrolytes and a bunch of other things depending on what is suspected to be causing. Moving on to management of the heart rhythm disorders. After you've diagnosed it, you know the type you have. Of course, in some types, there is what we call Valsalva manova, which is kind of like bearing down as if you're trying to poop, and when you have constipation, or people who've had babies. And there's specific massages we call the carotid, that tries to stimulate the vagus nerve, because the vagus nerve slows down the heart rate. Next is medications that we give either in acute cases in the hospital or for people to go home on. Another is pacemaker. So a pacemaker sets the pace. It's more useful, most used in people who have slower heart rates, because when the heart rate is too slow, you don't get enough blood, and in time also to all the organs, and people can have issues with that. So that sets the pace to whatever we want it to be. A defibrillator is another, and it's a pacemaker, stays somewhere at the top here, and then the wires go into the heart. Same with a defibrillator, except that a defibrillator this time, instead of setting the pace, it senses abnormal heart rhythm like ventricular fibrillation and shocks them to try and convert them back into a normal rhythm. Another modality is what we call cardioversion. Version is just to change, and this also is a type of shock, and we do this in acute cases. So when someone comes to the hospital suddenly, we're giving so many of these medications, things are not working, and they are what we call crashing, which means their blood pressure is not holding up, they can't stay awake and things like that. They have to take them to the OR and do a cardioversion, which is a type of shock to try and convert them back to normal rhythm. Last is ablation. And ablation is a kind of like it's not like zap. Basically, you're trying to electrocute sort of to kill the bad spots that are generating the bad or abnormal electrical impulse. Now, why is all of this important? It's because when we don't treat this, one, we talked about the symptoms, people fainting. So imagine someone fainting at home, there's nobody there, they faint outside, wherever it is, you hit your head. Those are dangerous things to happen. Losing consciousness is not a joke. Also, in the beating of the heart, the heart is supposed to squeeze fully and push out blood, but a heart that's beating too fast does not have enough time and energy, frankly, to squeeze fully. So it just squeezes a little bit, or it's just shaking. And when it's doing that, it doesn't eject the blood. When blood is still and not moving or stagnant, it has a high risk of forming clots. And this is how people can develop strokes or even throw clots into their lungs or other organs or parts of the body. And that's why they place them on anticoagulants / blood thinners. They're also the same thing. Finally is death. There's some of these heart rhythms that are bad enough that instantly they will cause death. There's some of them you have it, you feel sick if you're not taking care of it. It can lead to death from complicated things. So we will put a pin on it this week and just talking about the disorders of the heart rhythm. Thank you for tuning in and staying with us. I hope you've already subscribed. Make sure you follow us on our social media channels and share this video with your family and friends. Drop a comment, question. I'm Folake Lawal, signing out on Dodo's.